Okay, so knock knock. Gotta close the door for privacy and wash my hands. Can I have you verify your name and date of birth for me? I have an EMOTO, date of birth 12/1. Do you have any allergies, Mr. EMOTO? You do? Okay. Allergies to penicillin, cephalosporin, and midazolam, and the patient is wearing an allergy band to verify that. MR number 819-6375, 819-6375. Okay, Mr. EMOTO, we're going to be doing a full head to toe on you today. I'm going to start off with some vitals. So on the monitor, blood pressure is 158/98, heart rate is 102. I'm going to put this under your tongue. Temperature is 98.7 and O2 is 80% on room air. And I have a doctor's order to titrate oxygen until that reaches a 92%, so I would do that. Okay. Are you in any pain today, Mr. EMOTO? You are? Okay, on a scale from 1 to 10, what would that pain be? A 1 to 2? Okay, and where's that pain? Your knees? Okay, can you describe the quality of the pain? Sharp and it comes and goes? Okay, does it radiate anywhere? Non-radiating? Okay, what makes it better? That it goes away quickly? Okay, and what makes it worse? Turning knees. Okay, do you know where you are today? Fortis Hospital? Do you know what date it is? 5/21. Perfect. And do you know why you're here? Okay, complications for your heart failure. Yes. Okay, so I need this. All right, I'm going to shine this in your eyes and follow the pen for me. Okay, pupils are equal, round, and reactive to light, and they are also able to accommodate. My phone is going to be the death of me today. And the patient is also alert and oriented ×4. Have you had a cough recently, Mr. EMOTO? Yes? Okay. Are you able to cough anything up? Yes? Okay. And it's productive. What was the color of that? White. The consistency is thin. And about how much do you think you could cough up if you were to cough in a little medicine cup? 15 milliliters? Okay. I'm going to inspect the chest, and the chest rises symmetrically. I'm going to listen to 8 places on the front and 10 on the back. Okay, so I did hear some crackles in the lower lobes, and we have regular rate and rhythm. Slightly labored. Okay. Alrighty, so now we're going to be listening to the heart, starting with the second intercostal space to the right, which is the aortic, S1, S2. Second intercostal space to the left is pulmonic, S1, S2 heart. Third intercostal space to the left is Erb's point, S1, S2. Fourth intercostal space to the left is tricuspid, S1, S2. Fifth intercostal space, midclavicular line, is mitral, S1, S2 heard. I'm going to flip this over and listen for a full minute for the apical pulse. Okay. So a full minute has passed and the apical pulse is 102. And it is also a little bit irregular. Okay, so I'm gonna go over here and palpate the pulses, starting with the brachial pulse bilaterally, and that is +3. Radial pulse bilaterally is +3. I'm gonna check for capillary refill. And that is less than 3 seconds bilaterally. Can you squeeze my hands for me? Okay, and then push down and pull up. Okay, and strength on the bilateral upper extremities is +5. I'm I'm going to look in your mouth. Oral mucosa is pink, moist, and intact. Skin turgor is non-tenting. I'm going to assess the IV site now. The IV site is clean, dry, and intact. The dressing is dated. There's no redness, swelling, or infiltration noted. And at this point, I would flush to check for patency. Okay. Mr. EMOTO, when was your last bowel movement? Last night? Okay. And what was the color? Brown? The consistency? Soft? Okay. Did it have any unusual odor? No? Okay. And the size of that? About small? Okay. Gonna inspect the abdomen. The abdomen is flat, non-distended. Gonna auscultate in 4 quadrants. Starting with the right lower quadrant. Bowel sounds are active. Right upper quadrant. Bowel sounds are active. Left upper quadrant. Bowel sounds are active. Left lower quadrant. Bowel sounds are active. Okay. I'm going to palpate those 4 quadrants as well to check for any pain or tenderness. Starting with the right lower, no pain or tenderness. Right upper, no pain or tenderness. Left upper, no pain or tenderness. Left lower quadrant, and the patient denies any pain or tenderness upon palpation. Okay. When was the last time that you urinated? Okay, it doesn't say. What was the color of that? A dark yellow. Was it clear or cloudy? It was cloudy. Okay, did it have any smell to it? A strong smell? Okay, and about how much? Less than 100 milliliters. Okay, did you have any pain, urgency, or frequency? You had a decrease in frequency. Okay, so I'm just going to pull up the patient's gown and assess genitalia. And I don't see any presence of lesions, edema, abnormalities, discharge, or sores. So I would put that back down. I'm going to assess the lower extremities, the legs. I have a +3 pitting edema. The skin is warm, dry to touch. The color is appropriate to ethnicity, and I do not see any sores, lesions, or any presence of breakdown. Okay, so I'm going to wash my hands. Put on gloves. Okay, so I'm going to start by palpating the dorsalis pedis pulse on both sides, +1, posterior tibialis bilaterally is +1. I'm going to check for capillary refill. It's less than 3 seconds on both sides. And can you push down for me and pull up? And then the bilateral lower extremity strength is 5 out of 5. Take my gloves off. Wash my hands. Okay. All right, Mr. EMOTO, we are all finished for today. I'm going to put your bed down, rails up for your safety. Do you need anything else? No? Okay. Use your call bell. If you do need anything else, feel free to press it. Okay, I'm going to wash my hands and open the door.